Hello and welcome. In today's episode of Dr. Nora, I take you through everything you need to know about nasolabial folds, from what they are to how they're treated. First up, what are nasolabial folds? Well, these are the folds that run from your nose, from the side of your nose, through to the corner of your mouth. Now, these are considered as being normal. We all have nasolabial folds. In fact, if we obliterate our nasolabial folds, we look a little bit odd. However, what happens is as we get older, unfortunately, we all suffer from the aging process. Now, you'll find a really detailed video of how we age in another video of mine, which I'll leave a link in the description below. But briefly speaking, as we get older, our bones start to resorb. That means that they get smaller, they start to shrink down, and our beautiful fat pads that we have in our face also decrease. And unfortunately, because of gravity, everything starts to move downwards. And so the net impact of that is that our nasolabial folds, or those creases in between our cheeks and our nose, start to get a lot deeper, and they look a little bit more saggier. And generally the net impact of this is that we look really sunken in the middle of our face, and unfortunately we look a little bit older. But what can be done to reduce this? Well, there are a number of treatments that can be done to reduce the appearance of your nasolabial folds. As I said before, it's really important not to obliterate these folds, but to reduce or soften them in appearance. This video is primarily focusing on the use of dermal fillers to treat this area. However, there are a number of other different options, such as doing a facelift, fat transfers, and even thread lifts as well. Dermal fillers are commonly used in the cosmetic industry. We use them for lip fillers, we use them for cheek fillers, and so on and so forth. But did you know we also use them for our nasolabial folds? When they are placed strategically in this area, it reduces the appearance of those folds and gives us a nice, subtle and softer look of those folds. Fillers themselves are made up of hyaluronic acid. Hyaluronic acid is a man-made product of something that we already have in our skin. Hyaluronic acid helps keep us nice and plump and voluminous, and so as you can imagine, as we get older, our volume of hyaluronic acid also decreases as well. And so by injecting some man-made version of hyaluronic acid, it helps to increase the plumpness and the volume of that particular area. It's important to note that if you are going for dermal fillers, make sure you opt for a reversible option, because the permanent stuff, well, really has a whole bunch of other complications which I simply just don't have time to go through in this video. Now let's take a look as to where the fillers are placed for nasolabial treatments. This is considered as an area as being really quite high risk. That's because there's a lot of anatomy going on beneath the surface that we can't simply see with our bare eyes. And so it is so important that you go to a cosmetic practitioner that has a sound knowledge of the facial anatomy. In the nasolabial fold runs one of the main arteries of the face, and that is known as the facial artery. In fact, this artery runs laterally, so that means to the side of the nasolabial fold. However, the course of this artery is slightly different in different ethnicities. For example, those who may be of a Chinese descent, their facial artery runs actually within the nasolabial fold. And so it's so important for your cosmetic practitioner to know the differences and where anatomy may lie for different people. But what happens if you hit a facial artery, I hear you say? Well, the facial artery is, well, one of the main arteries of the face. And so it supplies the blood supply for the face. Now, if you were to nick, or if the practitioner were to nick this artery and to inject filler, say, into the artery, it is really not a good thing. Because when you inject filler into an artery, it leads on to something called necrosis, which means cell death. And that can lead on to skin death as well, so surrounding tissue death, but also more seriously, blindness as well. Now, this is considered as a big medical emergency, and the filler must be dissolved straight away. So, reiterating my point of choosing your cosmetic practitioner, it is vital that you choose somebody who has a sound knowledge of the anatomy. Of course, once you've found your great practitioner, they'll go on to injecting your nasolabial fold. At the root of the nasolabial fold is something called the piriform fossa. Now, this is just to the side of your nasal flare, and there's a small little triangle here known as the piriform fossa. This becomes a little bit more apparent as we get older. The reason being, as we said earlier, is because the cheekbones start to regress, or they start to get smaller, and the fat pads also start to reduce as well. And so some practitioners will go ahead and treat the piriform fossa, which will actually reduce the appearance of the nasolabial fold itself. Now, they may do this by using bolus injections, which means like a blob, if you like, of filler into this area, but they may choose to do it with a cannula. Now, a cannula is a blunt tipped piece of plastic that, once it's inserted into the right plane of the skin, hopefully reduces the risk of piercing those major arteries that we have in our face. Now, of course, cannulas are not 100% perfect. They certainly do reduce the risk of those horrible risks that we spoke about. Your practitioner may then also inject the nasolabial fold itself once they've treated the piriform fossa, and they may do this with either using a needle, or they may use a cannula as well. However, whichever technique your practitioner chooses to use, generally speaking, to reduce those risks of nasty things happening, they should be going nice and slowly and injecting small amounts of filler at a time. And of course, not forgetting the all-important in-treatment facial assessment. This is something that I do personally in my clinic because I like to make sure that I'm looking at the patient holistically, not just treating one area, but comparing the other side as well, because let's face it, sometimes we have asymmetrical faces and some areas need more filler than, say, the other side. Once you've completed your treatment, then hopefully your practitioner will massage the area, and this will usually involve putting a gloved finger inside your mouth on the outside of the mouth and just massaging any big major lumps or bumps. The idea is to reduce any appearance of any major blobs of filler because let's face it, nobody wants to have a blobby face. And once they've done this, then the filler is nice and smoothed out and you're ready to look at your after pictures. The filler will be expected to last about 12 to 18 months depending on your own individual factors. And depending on your own facial assessment, you may need more than one filler. Speaking of facial assessments, generally I tend to add on nasolabial folds to another treatment because if we put too much filler in the center of the face, we often get a really saggy appearance of the face and it feels really heavy because of our friend gravity. So often what I'll do is I'll have a look at the patient, do their assessment and consider whether they need to do anything else as well. That could be some cheek fillers, which helps to give some support to the top of the face. And then when you do inject the nasolabial folds, it doesn't feel as heavy and as saggy for the person. So there you have it, that's everything you need to know about the nasolabial folds, from what they are, what they should look like, and what treatment options are available. If you yourself are considering treatment for any cosmetic procedure, make sure that you speak to an adequately qualified cosmetic healthcare practitioner. And of course, if you have any questions or comments, please don't hesitate to leave me a comment section below, and I'll see you on the next one. Take care and stay healthy.